Every 65 seconds, a new Alzheimer's diagnosis shakes a family's world, and most caregivers feel unprepared and overwhelmed. But what if simple daily changes could ease that burden dramatically? Today, we're unlocking 18 life-changing strategies to make everyday living smoother for Alzheimer's patients. And number 7 might completely change how you communicate. What's the smallest change you made that brought the biggest improvement for a loved one with Alzheimer's? Share it in the comments. Your tip might help someone else today. 1. The power of predictable routines. Ever notice how chaotic mornings seem to throw the whole day off track? For someone with Alzheimer's, that chaos doesn't just throw off the mood, it throws off their sense of where they are, when they are, and who they are. Confusion spikes when the day has no shape. Set clear wake-up times, fixed meal times, and a consistent bedtime. Add a few daily rituals like tea after lunch or music before bed. Structure replaces fear. Think of it like setting a child's schedule, but for someone whose brain is trying to rebuild a map every morning. Routine restores peace. 2. Label everything, even the obvious. You might recognize your kitchen instantly, but to them, even the fridge can become a mystery. As Alzheimer's progresses, object recognition fades. What looks like a closet to you might feel like an endless void to them. Searching becomes distress. Place large, clear labels on cabinet doors, drawers, bathroom doors, even light switches. Use both words and pictures if needed. Labels reduce panic. Some caregivers are even using voice-activated tags or color-coded zones. That's next-level clarity. When in doubt, label it. 3. Color code for clarity. Imagine stepping into a kitchen where every drawer is white, every handle looks the same, and your brain can't tell one from the other. For someone with Alzheimer's, low contrast makes navigation difficult. A white toilet on a white floor? Invisible. A beige button on a beige shirt? Confusing. Use bold, contrasting colors, like red plates on white tables or blue rugs near doorways. You're not decorating, you're guiding. Studies show color contrast can even improve appetite and reduce fall risk. A small change, huge return. Color leads the way. 4. Use memory stations at key spots. Have you ever walked into a room and suddenly forgotten why you went there? For Alzheimer's patients, this happens constantly, and it's terrifying. Simple tasks like using the bathroom or locking the door become mental mazes. Set up memory stations at key transition points, like near doors, kitchen counters, or bathroom sinks. Use sticky notes, family photos, or one-step instructions. Memory lives in moments. You can even automate it. Motion sensors triggering reminders or lights at decision points. Reminders turn confusion into confidence. 5. Music unlocks memories. A woman who can't recall her daughter's name sings every word of an Elvis song from 1961. That's because music taps into emotional memory, often untouched by Alzheimer's until the very late stages. While names fade, melodies linger. Build a playlist of their favorite songs, especially from ages 10 to 30. Play it during routines like dressing or meals. Music remembers when we can't. Neurologist Dr. Oliver Sacks called music the key to locked rooms of memory. When words fail, music speaks. 6. Simplify, don't infantilize. It's tempting to treat someone with Alzheimer's like a child, but don't. Oversimplification can feel demeaning, while complexity creates confusion. Striking the right balance means preserving dignity while reducing stress. Offer 2 choices, not 5. Avoid abstract instructions like, get ready, Say put on your socks. Simple doesn't mean childish. Think of it like using plain language, not baby talk. Clear, calm, respectful. Clarity honors the person. 7. One idea per sentence. The average brain can juggle 5 ideas at once. Alzheimer's can barely hold one. Complex sentences or multi-step instructions quickly overwhelm. Go get dressed, brush your teeth, and come eat. Sounds like static. Break instructions down. Speak slowly. One task per sentence. This helps the message land and stick. Voice assistants or pre-recorded audio prompts can reinforce this without exhausting caregivers. Less words, more clarity. 8. Mirror their emotions, not logic. Ever try to reason with someone in a nightmare? When someone with Alzheimer's insists their long-dead parent is alive, correcting them can trigger fear, confusion, or even aggression. Don't argue. Instead, respond to their emotion. You miss her? That's okay. Empathy calms more than facts. Meet them where they are, not where you wish they were. Dementia care specialist Teepa Snow. Feelings outlast facts. 9. Anchor the day with familiar smells. Close your eyes, smell fresh coffee brewing. You know exactly what time it is. For Alzheimer's patients, scents act like invisible clocks. Lavender says it's time to wind down. Bacon means morning. The brain connects smell to memory fast. Use consistent, calming scents. Lavender before bed, citrus in the morning, or cinnamon before meals. Smells ground time. Scent cues are processed in the same part of the brain that handles memory, making them surprisingly powerful. Scent creates emotional timestamps. 10. Ditch the digital clocks. Numbers don't mean much when you've forgotten how time works. Flashing digital clocks, changing screensavers, and blinking microwave numbers confuse more than they help. Time becomes shapeless. Use analog clocks with big hands and bold numbers. Add day/date calendars in visible spots. Visual orientation is time's best teacher. Some smart home systems now mimic natural light changes to support time awareness. Technology that soothes, not stresses. Make time visible again. Are these tips making you rethink how you support someone with Alzheimer's? If even one insight resonated, hit that like button. It helps this reach more caregivers. And don't forget to subscribe. We're not done yet. Some of the most powerful strategies are still ahead. 11. Turn bathrooms into safe zones. The most dangerous room in the house isn't the kitchen, it's the bathroom. Slippery floors, poor lighting, and hard surfaces lead to falls, injuries, and hospital visits. For someone with Alzheimer's, a moment of confusion can mean disaster. Add grab bars, non-slip mats, raised toilet seats, and automatic nightlights. Safety upgrades prevent trauma and preserve independence. Some caregivers even add contrasting toilet seat colors or motion sensor sink faucets for ease. Safety restores freedom. 12. Turn meals into rituals, not races. When was the last time you sat down and truly enjoyed a meal? For Alzheimer's patients, noisy meal times or fast-paced feeding can cause anxiety and lead to skipping meals altogether. Appetite fades when the brain feels rushed. Simplify the table setting. Serve one dish at a time. Reduce background noise. Ritual calms the appetite. Some caregivers light a candle or say a familiar phrase before eating. It signals warmth, not urgency. Rituals feed more than hunger. 13. Touch equals communication. A man with advanced Alzheimer's hadn't spoken in days until his daughter gently stroked his hand and he smiled. As verbal skills decline, touch becomes one of the last reliable ways to connect. A gentle hand on the shoulder can say, "I see you," louder than any words. Use reassuring touch during transitions or moments of confusion. Hand-holding, light back rubs, brushing their hair. It's not just comfort, it's connection. Research shows physical contact can lower cortisol and reduce agitation in dementia patients. Touch builds trust. 14. Create a safe exit strategy. It's 3 a.m. Your loved one thinks they're late for work and heads out the front door. Wandering is one of the most dangerous and common behaviors in Alzheimer's. Even 5 minutes alone outside can be life-threatening. Install door chimes or motion sensors, hide exits with curtains, or place child-safe locks out of reach. Create safe paths to wander, like enclosed gardens or looping hallways. Some caregivers now use GPS-enabled shoes or ID bracelets for added security. Freedom doesn't mean danger. 15. Use doll therapy or comfort objects. Sometimes a simple doll or soft blanket can calm a storm of confusion. Many Alzheimer's patients instinctively seek comfort in nurturing objects, which reduce anxiety and aggression. It's not childish, it's therapeutic. Offer a soft doll, plush animal, or sensory blanket during moments of distress. These objects can anchor feelings and bring calm. Dementia specialist Teepa Snow calls this comfort connection, a powerful nonverbal therapy. Comfort heals where words fail. 16. Reduce noise pollution. What's background noise to you can be overwhelming chaos to them. Multiple sounds, TVs, phones, conversations can heighten anxiety and confusion in Alzheimer's patients. It's sensory overload. Create quiet zones, use soft background music, and minimize overlapping noises. Noise control soothes the mind. Some caregivers use noise-canceling headphones or soundproofing to create calm spaces. Silence speaks louder than words. 17. Validate, then redirect. What happens when you argue with someone living in a different reality? Correcting false beliefs in Alzheimer's patients often triggers fear or anger, escalating stress. Acknowledge their feelings first. Say, "I understand," then gently guide the conversation to safer ground. Validation soothes agitation. Validation therapy is a bridge, not a battleground. Dementia care expert. Agree to connect, not to argue. 18. Celebrate micro wins. A caregiver cheers when her father with Alzheimer's remembers to brush his teeth. Small victories matter. Every small success builds confidence and motivation, often overlooked in the daily struggle. Praise achievements, however minor. It fuels hope and fosters a positive environment. Tracking micro wins can reveal patterns that help tailor care routines. Small wins spark big hope. Each tip we've shared today has a simple goal: to bring more calm, dignity, and connection into the daily life of someone with Alzheimer's. While the diagnosis itself can't be changed, the experience can be changed with patience, creativity, and love. If you found these strategies helpful, stay tuned. In our next article, we'll explore the stages and progression of Alzheimer's disease. Don't forget to subscribe so you don't miss out on these life-changing insights. This video provides general information and is not professional medical advice. Please consult a qualified healthcare provider for personalized guidance and treatment.